Over 65. How masturbation affects prostate health. Senior health tips. Have you ever wondered how a small organ in your body can significantly impact your health and quality of life? The prostate, a tiny gland quietly situated below the bladder, is the silent hero in the male body. However, when subjected to excessive strain, particularly from frequent masturbation, it can send alarming warning signals. Let's explore the role of the prostate and why you should pay attention to it, especially as you enter middle age and beyond. The prostate, the small hero in your body. The prostate, though only the size of a walnut, plays a crucial role in the male reproductive system. It produces a special fluid that makes up a significant portion of semen, protecting and transporting sperm on their journey to the egg. Additionally, the prostate helps regulate urine flow, ensuring normal urination. Think of the prostate as a dedicated manager, overseeing both reproductive health and the smooth functioning of the urinary system. But what happens when the prostate is overworked? Studies from the American Urological Association, AUA, indicate that the prostate in older men becomes more sensitive to external factors, including lifestyle habits like masturbation. Particularly after age 50, the prostate tends to enlarge a condition known as benign prostatic hyperplasia, BPH, making its health more critical than ever. Curious about what could put your prostate at greater risk? Keep reading to discover the impact of excessive masturbation. The effects of excessive masturbation. Masturbation is a natural and healthy activity when done in moderation. However, when it becomes excessive, such as daily or multiple times a day, it can place significant stress on the prostate. A 2016 study published in Urology found that frequent ejaculation can stimulate the prostate to produce fluid continuously, leading to temporary swelling or enlargement. This may cause discomfort in the lower abdomen, mild pelvic pain, or prolonged fatigue. Picture the prostate as a water pump working tirelessly. If you force it to operate non-stop without rest, it becomes overloaded. Experts at Harvard Medical School note that this can lead to non-bacterial prostatitis, causing pain, discomfort during urination, or a burning sensation after ejaculation. Wondering if frequent masturbation has any benefits? Let's explore a surprising perspective. Surprisingly, moderate masturbation can benefit the prostate. A large-scale 2016 study from Harvard Medical School found that men who ejaculate regularly, about 4-7 times per week, have a lower risk of prostate cancer compared to those who ejaculate less frequently. Ejaculation helps clear out harmful toxins accumulated in the prostate, reducing the risk of inflammation. However, exceeding this moderate threshold can lead to more serious issues. Excessive masturbation can increase blood flow to the prostate, causing temporary swelling. If prolonged, this may make the prostate more sensitive, prone to irritation, or even lead to chronic inflammation. A 2018 study in the Journal of Sexual Medicine found that men who masturbate excessively are at higher risk of urinary issues, such as weak urine flow, frequent urination, or the sensation of not fully emptying the bladder. Want to learn how to recognize your body's warning signs? Keep reading. Warning signs from your body. Your body always sends signals when something is wrong, and the prostate is no exception. If you experience mild pain in the lower abdomen, discomfort during urination, or ejaculation that no longer feels satisfying, these could be signs that your prostate is overloaded. Experts from the Mayo Clinic recommend not ignoring these symptoms, even if mild, especially in older adults when the prostate is more vulnerable due to aging or underlying conditions. Notably, overly vigorous masturbation or not using lubrication can increase the risk of prostate irritation, leading to a burning sensation or pain after ejaculation. Excessive masturbation can cause 7 serious harms to the prostate, particularly in older adults. Let's explore the 7 main harmful effects of excessive masturbation on the prostate, presented clearly and concisely. Temporary prostate swelling or enlargement. Frequent masturbation, especially daily or multiple times a day, forces the prostate to produce fluid continuously, leading to temporary swelling or enlargement. This can cause a heavy sensation in the lower abdomen, mild pelvic pain, or discomfort when sitting for long periods. According to a 2016 urology study, this condition is generally not dangerous, but can cause fatigue if not addressed with proper rest. Non-bacterial prostatitis. Excessive or overly vigorous masturbation, particularly without lubrication, can cause irritation or microtrauma to the prostate, leading to non-bacterial prostatitis. Symptoms include pelvic pain, a burning sensation after ejaculation, or discomfort during urination. A 2018 Journal of Sexual Medicine study notes that chronic inflammation of this type can persist and impact quality of life. Urinary disorders. Excessive masturbation increases pressure on the prostate, leading to issues such as weak urine flow, frequent urination, nocturia, nighttime urination, or the sensation of not fully emptying the bladder. According to a 2019 Journal of Urology study, these disorders are more common in older men, especially when the prostate is already sensitive due to aging or BPH. Prostate exhaustion. When the prostate is forced to work continuously without rest, it can become exhausted, similar to an overworked machine. Symptoms include less satisfying ejaculation, mild lower abdominal pain, or overall fatigue. The Cleveland Clinic emphasizes that this condition can reduce sexual quality of life if not addressed. Adverse hormonal changes. Excessive masturbation can cause slight fluctuations in testosterone and DHT levels, two hormones critical to male health. A 2020 Journal of Endocrinology study suggests that these changes may lead to reduced energy, fatigue, or decreased libido. In older adults, these effects can be more pronounced and increase the risk of BPH. Increased pelvic sensitivity. Continuous prostate stimulation from excessive masturbation can make the pelvic area more sensitive, leading to mild pain or prolonged discomfort. A 2017 European Urology study indicates that this condition can become chronic if not managed, affecting daily activities like sitting or walking. Impact on mental health. Excessive masturbation doesn't just affect the body, it can also cause stress or anxiety, especially if you notice abnormal symptoms like pain or reduced ejaculation quality. A 2019 psychosomatic medicine study highlights that prostate issues, including inflammation or urinary disorders, can increase psychological stress, impacting sleep and overall quality of life. Note: these harms do not mean masturbation is entirely harmful. When done in moderation, it can offer benefits like reducing prostate cancer risk or improving mood. However, for older adults, controlling frequency and listening to the body are crucial to avoiding these adverse effects. Solutions to protect your prostate. To keep your prostate healthy, listen to your body. Experts recommend taking rest days and avoiding continuous sexual activity. A balanced diet also plays a vital role. Foods rich in omega-3, like salmon and flax seeds, zinc pumpkin seeds, oysters, and vitamins D and E can enhance prostate health. A 2019 American Journal of Clinical Nutrition study found that zinc and omega-3 can reduce inflammation and support prostate function. Regular exercise, particularly pelvic exercises like Kegels, can improve blood circulation and reduce prostate pressure. Additionally, stress management is essential. Chronic stress can elevate cortisol levels, negatively impacting the immune system and prostate health. Curious about a secret to maintaining long-term prostate health? Keep reading. The importance of balance. Balance is the key to protecting your prostate. Moderate masturbation not only supports prostate health, but also promotes relaxation and improves mood. However, overindulgence can lead to long-term risks like chronic inflammation or urinary disorders. Experts from the Cleveland Clinic emphasize that older men should pay special attention to the frequency and intensity of sexual activities, as the body recovers more slowly with age. Take time to care for yourself, both physically and mentally. Adequate sleep, a healthy diet, and moments of relaxation will help your prostate function better. Wondering about other factors that might affect your prostate? Let's dive deeper in the next section. Hormonal impact. A new perspective. Frequent masturbation can affect hormone levels like testosterone and DHT, which are vital for male health. A 2020 Journal of Endocrinology study found that high ejaculation frequency can temporarily lower testosterone levels, leading to reduced energy, fatigue, or decreased libido. These changes are often minimal in younger men, but can be more significant in older adults. Moreover, fluctuations in DHT hormone linked to prostate growth may increase the risk of BPH. This is particularly relevant for men over 50 when BPH becomes more common. Want to know how to naturally balance hormones? Keep exploring. Long-term consequences of overuse. Excessive masturbation not only stresses the prostate but can also lead to long-term issues. A 2019 Journal of Urology study found that men who masturbate excessively are at higher risk of urinary disorders, such as nocturia, weak urine flow, or incomplete bladder emptying. These issues can disrupt sleep and daily life. Additionally, overly vigorous masturbation or lack of lubrication can cause microtrauma in the pelvic area, increasing the risk of chronic prostatitis. A 2017 European Urology study notes that chronic prostatitis can lead to persistent pelvic pain, significantly impacting mental health. Curious about how to recognize and prevent these issues? Read on. Listen to your body. The key to health. One of the best ways to protect your prostate is to learn to listen to your body. If you experience pelvic pain, discomfort during urination, or less comfortable ejaculation, it's time to reduce frequency and focus on relaxation. Mayo Clinic experts recommend that older men maintain a moderate sexual activity schedule, such as 2-4 times per week, depending on overall health. Regular health checkups are also critical. A PSA, prostate-specific antigen, test can detect prostate issues early, including cancer risk. Want to know a simple yet effective way to protect your prostate? Keep reading. Diet and exercise for prostate health. Diet plays a significant role in maintaining prostate health. Antioxidant-rich foods like tomatoes, containing lycopene, walnuts, and broccoli can reduce inflammation and protect the prostate. A 2020 nutrition and cancer study found that lycopene may lower prostate cancer risk in older men. Exercise is equally essential. Activities like walking, yoga, or swimming improve blood circulation and reduce stress, supporting prostate health. A 2018 Journal of Aging and Physical Activity study found that older men who exercise regularly have a lower risk of prostate issues. Curious about a surprising secret to prostate health? Read to the end to find out. The mental health connection. Few realize that mental health is closely linked to prostate health. Chronic stress can elevate cortisol levels, weakening the immune system and increasing the risk of prostatitis. A 2019 psychosomatic medicine study found that men under frequent stress have a higher risk of prostate-related urinary disorders. Take time for relaxing activities like meditation, reading, or spending time with friends. These moments not only make you feel better, but also support prostate function. Want to discover an unexpected secret about prostate health? Keep reading. The Vital Secret, The Power of Sleep. An often overlooked but critical factor for prostate health is sleep. Quality sleep allows the body to recover, regenerate cells, and balance hormones. A 2020 sleep medicine study found that men who sleep less than 6 hours per night have a higher risk of prostate issues, including inflammation and BPH. Conversely, 7-8 hours of deep sleep nightly can reduce inflammation, improve blood flow, and support prostate health. Establish a routine of going to bed on time, avoiding blue light from phones before sleep, and keeping your bedroom cool and quiet. This simple habit can make a significant difference in your health. Conclusion: prostate health is not just about the gland itself, it impacts your overall quality of life. Start with small changes. Eat healthily, exercise regularly, sleep well, and listen to your body. If you notice any unusual symptoms, don't hesitate to consult a urologist for timely advice. At Senior Health Vista, we strive to provide helpful, clear, and relatable information to help you live healthier every day. If you found this article valuable, subscribe to the Senior Health Vista channel today to stay updated with more insightful content. Together, let's build a healthier, happier life.